Dr. Caitlynn's here.
Yeah.
Hey, Dr. Caitlynn, on the couch. Doug's gonna go over there to talk to you.
Yes, making my way over. Dr. Caitlynn, okay, so the topic is croup.
Yes.
And I think we need to start with just a straight up definition because I think this gets misused quite a bit. I mean, as parents, because we get confused with that other technical term, the crud.
Yeah.
And they can get a little confusing.
Yeah, so croup is basically, in the medical definition, what we call an obstructive laryngitis. So you think laryngitis, like in older people, you lose your voice, right? So it's an obstruction right around that area of the respiratory tract. And so in little kids, you know, their trachea, their larynx is much smaller than in you and I. And so they can actually, when they have that narrowing right there occur, and it usually is from a virus. There's multiple ones that can cause it. The most common is parainfluenza virus, but flu B is doing it this year. COVID has done it in the past. RSV has been a little bit of a croupy cough. And so you get that narrowing, and basically what you're hearing is this barky, I mean, it sounds like a seal, right? It's like this barky cough, and then these kids, whenever they're taking a deep breath, you get this kind of gasping noise. And so it can be very scary. And the worst part is it always almost hits at night. So like 2 a.m. you wake up and your kid's like struggling to breathe and they can't get that air in and they have that barky cough and you're like, oh, now I have to make it to the morning to get to the pediatrician, or do I go to the ER, right?
Do you find some confusion with parents too about, oh, this might be allergies, this might be seasonal versus a viral?
Yeah, and sometimes croup can be caused from allergies too. So I mean, it can be sort of a spring thing where you're allergic to something in Kentucky and it can sort of induce that. But yeah, so I mean, it can be allergic, it can be viral, but those are the two most common causes, and both of them present the same way, where you just have this sudden onset of this really barky cough and this big like gasping noise. So
obviously parents on alert and frightened when they hear that bark. What's the fast fix for us?
What can they do? So the biggest thing is getting some humidified and cold air. So this time of year, take your kid outside, wrap them in a blanket, let them breathe in, you know, that really cold air. Or put a humidifier, or go in the bathroom, close the door, turn the shower up, breathe in some of that, you know, steam from the shower. That usually does help kind of bridge it over until you can get to the doctor.
That's a great fix. Dr. Caitlynn, we appreciate it. Back with more after this. Stick around.